Hi, I'm Natasha Jackson. I'm a registered nurse and care management strategist. I help healthcare organizations implement technology supported care management models that improve patient outcomes while also increasing practice revenue. And I teach nurses how to build care management businesses aligned with how healthcare is actually being reimbursed today. Now, today, we're going to break down something that a lot of people still don't fully understand: what a nurse care manager actually does, because many providers don't fully understand the role. And honestly, a lot of nurses don't either. They hear care management and think it's just follow up calls, check ins, or that it's the same as case management, and it's not. Care management is structured, it's clinical, and it plays a central role in how patients are managed over time. A nurse care manager is responsible for making sure that the patient's plan of care is actually carried out, implemented, supported, and adjusted over time. This role sits between office visits and it connects everything. Let's start with care plans, because this is the foundation of care management. As registered nurses, we've been trained to think this way from the beginning: assessment, diagnosis, planning, implementation, evaluation. That doesn't change. What changes is how it's applied over time. In care management, the care plan becomes a living document. It outlines the patient's conditions, goals of care, interventions, barriers to care, follow up needs, and the nurse care manager updates that plan based on what's actually happening with the patient, not just what was documented during the visit. Now, let's talk about medication management, because this is where a lot of issues happen. Patients with chronic conditions are often on multiple medications, but no one is consistently checking: are they taking them correctly? Are there side effects? Are there duplications? Can they afford them? A nurse care manager reviews medications regularly. They simplify instructions. They identify problems early. And they communicate with the provider when something needs to be adjusted. This alone can prevent complications and hospitalizations. Next is patient follow up. This is where consistency comes in. After a visit, the nurse care manager checks in with the patient, not once, but ongoing, to make sure the care plan is being followed. Symptoms are stable. There are no new concerns. This is where problems are identified early, before they escalate, before they turn into emergency room visits or hospital admissions. Now let's talk about patient education, because this is where nurses make a real impact. Patients don't just need information, they need understanding. A nurse care manager takes the time to break things down in plain language, reinforce instructions, answer questions patients didn't ask during the visit, teach patients how to manage their conditions day to day. And this doesn't happen in one conversation, it happens over time through repetition, support, and trust. Another key role is care coordination, because most patients are not just seeing one provider, they're seeing primary care, specialists, going for labs, imaging, and no one is connecting all of it. The nurse care manager helps coordinate referrals, ensure follow ups are completed, share information between providers, keep everyone aligned on the plan of care. This reduces duplication, confusion, and gaps in care. And finally, patient engagement. Because if the patient is not engaged, nothing else works. The nurse care manager builds relationships. They create trust, they keep patients connected to their care. And when patients feel supported, they're more likely to follow through. They're more likely to stay consistent. They're more likely to take ownership of their health. This is not a small role. This is the role that ensures care actually happens outside of the visit. It's structured, it's clinical, and it's essential to improving outcomes. And as healthcare continues to shift toward value based care, this role becomes even more important, because outcomes are no longer based on what happens during the visit alone. They're based on what happens after. If you're a nurse and you want to learn how to step into this role or build a business around care management, I break this down inside my online school, Empower Care Academy. I'll leave the link below so you can join us. And if you're a provider looking to better support your patients while improving outcomes and increasing revenue, care management is one of the most valuable services you can implement. Make sure you like this video, subscribe to the channel, and I'll see you in the next one.